When we talk about World Sleep Day and we want to really bring awareness of the importance of sleep, is because it affects so many areas of functioning. It affects the cardiovascular system, it affects glucose control, it affects our memory, our learning, our behavior, our emotions. So it is very, very important to be aware of having a good sleep schedule, regular sleep routine, but also to be able to identify and recognize a sleep disorder. Because you can do everything right, go to bed at the right time, wake up at the right time, try to get a restful sleep, have a regular diet, avoid caffeine, and if you're still waking up at night, you may have a sleep disorder and you need to be evaluated. There was a study with the influenza vaccine that showed that people who were sleep deprived the week before getting the vaccine did not produce enough antibodies after the vaccine compared to the people that slept good nights, the right amount of sleep. So sleep is very important even around your vaccination time for your immune for your immune system to produce the right amount of immune response after the vaccine. I would like to extrapolate and to be safe to recommend patients to really get good night's sleep all the time, but especially now during the pandemic and around the time of vaccination. What we're seeing lately is sometimes because of the length of the pandemic and the isolation, stress has kicked in, and we're seeing interrupted sleep. There have been publications about dreams during the pandemic or nightmares, or in situations in which the stress levels are increasing and affecting sleep as well. So difficulty sleeping, having nightmares. Again, stress is also bidirectional because lower amounts of sleep can increase your stress levels, but at the same time, higher stress levels and anxiety can interrupt your sleep. The American Academy of Sleep Medicine has recommended now to drop the time changes because of the changes that it produces and the time to adapt to the new system and how it affects people. So we want to turn electronics at an appropriate time. We recommend at least an hour before bedtime and start with relaxing activities. For some people, is reading a book, or for other people, especially in children, singing songs, reading stories, having something relaxing. In terms of avoiding certain substances, I would say avoid caffeine even 6 to 7 hours before bedtime. So usually by 3 o'clock, that should be the limit. So limit your caffeine for the morning or at lunch the latest, but no caffeine in the afternoon. Regular exercise as well, like go out, have a walk in the afternoon, but not really high activating exercise right before bedtime, which also could delay your sleep. Have your dinner a couple of hours before bedtime, and maybe a snack, but not a high sugary or a lot of liquids right before bedtime. That is going to make you wake up in the middle of the night to use the bathroom.